Welcome everyone to the UCD COVID-19 Research Seminar Series. My name is Sinead McGinley and I work in UCD Research, and UCD Research is hosting these talks each Wednesday at 2 p.m. for 30 minutes. The purpose of the seminar series is to showcase ongoing COVID-related research at UCD across the 6 colleges of the university, and to help facilitate greater interdisciplinary collaboration within UCD and also with external partners. Today, we're delighted to be speaking with Dr. Sharleen O'Reilly from the UCD School of Agriculture and Food Science and Associate Professor Clare Corish from the UCD School of Public Health, Physiotherapy and Sports Science. So just to briefly introduce you to our speakers, before we begin, Sharleen is a CORI registered dietitian who works at the interface of research, training, teaching and practice in public health nutrition. Sharleen graduated from Trinity College Dublin with a degree in human nutrition and dietetics and also a PhD. And in 2019, she was awarded Research Dietitian of the Year by the Irish Nutrition and Dietetic Institute. Her current research interests lie in research translation and how chronic disease prevention and management can be better implemented in the real world. And her work is focused on taking what we know works in clinical research settings and developing implementable solutions to improve population health. And Clare has a background in human nutrition and dietetics and has worked for over 15 years in the practice in Ireland, the UK and Saudi Arabia. Clare was appointed as an associate professor in clinical nutrition and dietetics at UCD, where she has established a professional graduate program in clinical nutrition and dietetics, the first such program in the Republic of Ireland. She has a long-standing commitment to nutrition research activities, particularly in disease-related malnutrition and also in the older person, nutrition in early childhood, and nutrition and lifestyle among shift workers. So we're delighted that Sharleen and Clare are here today, and they're going to talk to us about the impact of COVID-19 on healthcare profession education and professional practice placements, and also the innovative solutions that have been generated across these programs. So before I hand over to Sharleen and Clare, just to say that we'd be delighted to get your questions and comments. Please feel free to use the Q&A feature or the chat box at the bottom of your Zoom screen there, where you can post questions. I'll then at the end leave time for us to facilitate a Q&A discussion where you can make comments or ask questions to Sharleen and Clare and they'll respond. And also please feel free to post questions as the presentation is happening. So Sharleen and Clare are going to give us a short 15-minute presentation, and then, as I said, we'll have time at the end for questions. So without further ado, I'll hand over to Sharleen, who's going to start the presentation. Thank you very much.
Super. Thanks very much, Sinead. So as Sinead said, we're going to be focusing in on the healthcare professions and the impact that COVID-19 has had on those placements. So I'm going to start off and Claire's going to pick up the lead after that. So if I just go on to my next slide, I think this slide speaks volumes to where most of us feel that we have to cope with when it comes to our practice placements. You know, you're usually just coping to actually coordinate the placements, get the students out there and ensure that they meet the requirements for each healthcare profession and the registration bodies that are linked to them. So it's a challenge, but then COVID came along, and I think that caused us to stop and pause to see what actual impact COVID was actually having on practice placements, and were people within healthcare professions still able to deliver on the quite explicit demands that our registration demands on us in terms of turning out qualified healthcare professionals. So we wanted to unpack that a bit more, but also learn from that so that we can provide some evidence to the evidence base around what are solutions that people have put together to tackle this solution. So in looking at that, we put together a study and we designed it to be an online anonymous survey. We used Qualtrics. There was about 36 items in the survey. And it was at the end of wave 1 of COVID that we decided to roll it out. The reason being that hopefully people were back and had a little bit of time to reflect on what changes they had made during that active trimester or semester. We contacted the programme directors of registered healthcare professions and that spanned English language speaking countries, mainly because we were doing this without any resources behind it. We emailed them based on the information from the registration bodies around which programs were there, and where there was a named program director, we sent them an email inviting them to participate. The survey, as I mentioned, was online, and it had three main sections to it. The first being what the actual program was, whether it was undergraduate, postgraduate, what profession they were training the students for, and then also the characteristics of the students within the program, and also the characteristics of the director, because that also too can have bearing on how well somebody has the ability to resource changes within the program. We then collected another section of information around the COVID-19 impact on the program and how the students and progression of the students was actually happening during that first wave. And then the final section was around the impact of COVID-19 on the work of the program directors. So looking at both workload and work-life balance, and then also the aspect of their take on how COVID-19 had impacted their health service. So that in turn will also affect their ability to deliver placements, obviously. So we took all that information and sent it out in the survey and hoped to get some responses back. And we actually got a really good uptake considering the stresses and strains of COVID-19 were placing on universities. And similarly, because it is the summertime, we also expected to have a lot of people out on annual leave. So we had 27% of a response rate based on the 197 that we sent out. And we got coverage across 7 countries. So we had Ireland, the UK, Australia, the USA, Canada, as well as Germany. And I think in terms of programs, we were quite happy with the spread of professions that we actually got coverage of. We got 37% was from dietetics. We got uptake in occupational therapy, speech and language therapy. We had physio. We also have in that other section that you can see there on the screen, we had nursing, we had podiatry in there, as well as we didn't have uptake in medicine, midwifery and radiography, mainly because those programs are more spread in program director roles, that they don't typically have one person who is responsible for those programs. So it was more difficult to actually get a representative to feed back to us on that. But we had also a good spread of undergraduate and postgraduate programs, as we would expect. And similarly, the types of placement hours were what we had assumed. It was, you know, a split of about 1/3 to 2/3, having 1,000 hours or less versus over 1,000 hours placement required. And then the program size, as we would have expected as well, was between sort of 25 and 100 students, being the average that most healthcare training programs have. And most programs would say that they have a relatively low failure rate or requiring additional time for practice placements, but where there were practice placements provided, they typically tended to be longer blocks of time, so 4 weeks or more, or 1 to 2, a short kind of top up. And most students don't tend to apply for extenuating circumstances while on practice placements due to mental health issues. So it's typically less than 3 in a program. So about, you know, half would be an uncommon thing to have mental health challenges. So while it does happen, it wasn't the most common occurrence. So overall, we got the types of programs we were expecting. And now Claire is going to go into a bit more detail on the COVID sections of the survey. So Claire, I'm handing over to you now.
Okay, thank you, Sharleen. Okay, so what I'm going to do now is present the results of our survey. So just to bear in mind, as Sharleen said, that at the time of data collection, COVID-19 had been impacting on these healthcare profession programs for an average of 15 weeks, plus or minus 7 weeks, when we got all the responses in. So the results of our study are very much a snapshot of what was happening and what was reported over the summer of 2020. It is purely that. As Sharleen already alluded to, the most significant impact was on practice placements, with, as you can see here, rescheduling of practice placements being the most frequently reported occurrence. The associated workload for program staff, not just the program directors who are surveyed, but also the program staff, as well as the anxiety and uncertainty for students who must complete these clinical placements as a mandatory component of their programs to graduate as healthcare professionals, cannot be underestimated. The modifications that were reported as being made to placements were predominantly a move to online, so some face-to-face moving to online placements, and or a reduction in placement duration, particularly the on-site aspects. Another important issue that was reported was that some students in a cohort were able to complete their placement and therefore their programs in time and able to graduate, whereas others in a class were not. And this obviously created, again, huge anxiety, uncertainty for both the students impacted by this and for the staff on these programs. Other impacts over and above the placement, which is obviously the most critical, but other impacts were seen on final year assessments, in particular final year written exams, most of which the response was to move them to online or to MCQ format. Where programs had OSCEs on their programs, these all had to be postponed. And again, this increased the workload, the anxiety for both staff and students. For the longer term perspective, the effect on student intake was noted, in particular how this affects international students coming onto programs. And the impact of this on the financial viability of healthcare programs and programs' abilities to run over the coming years is likely to be considerable. And also, I suppose, what is a huge benefit of having an international mix of students on a program like that global or more international perspective that you get where you have a mix of students on a program will be lost if only national programs are enrolled onto programs, onto healthcare professional programs. Charlie, next slide. The qualitative data reiterated the quantitative study findings. So as Sharleen said, the survey was made up of quantitative data survey, but also respondents were given the opportunity to give comments. So the qualitative data very much reiterated the quantitative study findings. And the main themes that were seen were the innovative adaptations that occurred, the lasting impact for practice placement provision, the need to integrate online learning, and the detrimental effects on student health and well-being. However, some positives were also noted, as can be seen in the quote. So what can be seen is this amazing shift to creative and effective telepractice approaches, which were reported by one speech and language therapy program in Canada. The negative aspects, unfortunately, were also very much noted, and they probably came across a lot more predominantly. And you can see here this quote from an OT program director in the UK. It's going to be a long time until anything is normal. We'll be running a program with less face-to-face, more online, practical content stripped back to the basics, as it affects the timetable drastically due to social distancing. The final theme that was noted from the qualitative data was that health service, whole of profession and greater university support at a high level is needed to resolve the issues pertaining to practice placement education if competent and safe healthcare practitioners are to be educated. And to do otherwise has potentially huge detrimental impacts on health service delivery over the coming years. And the quote you can see here, that academic and clinical staff as well as students need greater high-level support from both the health service as well as the academic institutions. For an individual country, for example, Ireland, deficits in the education of healthcare professional graduates will not be rectified by international recruitment, given the global effects of COVID-19 on healthcare professional programs, as has been demonstrated by our study. The survey results on the direct effects of COVID on programme directors again indicated the issue of practice placement availability, as well as the negative effects in working from home and on the health service as a whole. So although similar concerns, as you can see, were noted by all programme directors, physiotherapy programme directors specifically noted the detrimental effects of working from home on their eating habits, and OT programme directors were more likely to report the changed demands of the health service and burnout as expected detrimental effects of COVID on the overall healthcare delivery of healthcare in the future years. This figure summarises both the short-term or immediate effects and the longer-term effects of COVID-19, specifically on healthcare programmes. The effects of practice placement are considerable, with ensuing anxiety and workload for both students and staff. The financial impacts on programmes and longer-term effects on staff must also be considered. Two positive effects to come out of the survey were firstly the increased awareness of infection control, which is vital to retain even when the pandemic ends. And secondly, the use of telehealth and the potential use of skills attained by healthcare professional students in the immediate and longer term planning and delivery of healthcare services across the world. So in summary, COVID-19 had immediate and longer term impacts on healthcare profession programmes. Student professional practice placements were negatively affected by COVID-19 as majority had to be rescheduled and some aspects had to be moved online. Programme directors and their staff adopted innovative solutions to address practice placement issues, but the evidence base for these is still lacking and further research is needed and further evaluation of how these will actually influence and impact the competence and safety of the healthcare professions moving forward. The workload of programme directors arising from COVID-19 is not sustainable. And this, although this was the questions, the survey was directed at programme directors, I think all of us who are working as programme directors on these programmes would reiterate that this also affects staff teaching practical classes and those directly responsible for organising and managing placements. The potential impact on health service delivery in the longer term is worrying. The longer term effects in producing the healthcare professionals competent to work in healthcare delivery is really of concern, and the high level input from the health service and from the universities and everybody, the professional bodies and everybody working in a very joined up manner is really vital at this stage in order to ensure that these vital healthcare professionals are safely qualified. Finally, Sharleen and I would like to thank all of those programme directors who took the time to report and on what they were doing on top of already heavy workloads. We'd also like to thank Sarah Pollard, who has just completed her MSc in Clinical Nutrition and Dietetics here in UCD, who analysed the data for us and wrote it up, and was helped by one of the recent graduates from the BSc in Human Nutrition, Laura McBean. And Sarah was actually one of those students who whose placement was impacted by COVID and who actually went on placement in mid-June, so shout out to St. Luke's and Kilkenny while I'm on, say thank you very much, it's much appreciated. The other thing, I suppose, that any learning from this, we would really like to offer our support to the health service executive, to any health services nationally or internationally who are interested in the information. So the support and information gleaned from the survey and our experience throughout the pandemic, you know, both staff and students learned a lot, and really, I suppose the important thing now in future planning is that we, you know, use our learning and use our experience to try and, I suppose, take the good and get rid of the bad and really progress, as Sharleen alluded to initially. And finally, we would like to thank Sinead McGinley and UCD Research for giving us the opportunity to share our study findings with you all, and thank you.
Thank you very much, Sharleen and Claire, for that fantastic presentation. Apologies, the sun is just suddenly coming in on my window, so I've gone a bit of a two-toned colour there. But thank you very much for that presentation. So just a reminder that we have around 8 minutes now for questions or comments from the audience. We've received a lovely comment from someone who said, great research undertaken by the researchers already under significant stress will prove very valuable as a qualitative and quantitative data source. Well done. So thank you very much. That's great. So maybe just to kick off the questions, you just touched on there at the end, Claire, about the learnings from this piece of research that you did during, I suppose, the first wave of COVID and the lockdown. And I was just wondering how you think this information can be used going forward and what we can learn from it, you know, in terms of potential future, you know, pandemics or situations like this where we may have to move to more remote or online type placements. So what do you think maybe is the key learnings from all of this information?
I think that nationally we have great resources and that we should be using them, and that, you know, within, say, we're lucky in Ireland that we have a health and social care professions office that I suppose part of the responsibility is around provision of education for, you know, for health and social care professions. We also have a regulatory body that plays a vital role. And I suppose it would be nice to see at a coordinated level, maybe within the health service, that the learning that would come from, say, the different universities, because within Ireland we have, you know, a number of universities, Galway, Limerick, Cork, you know, even in the north of Ireland, we have universities, the Dublin universities, that we could actually share this, and there could be some sort of a forum in which we could, I suppose, try and tease out what works, because we're all trying to produce the same product at the end, whether it's an undergraduate program or a postgraduate program, whether it's in physiotherapy or whether it's in occupational therapy or dietetics or speech and language therapy, podiatry, whatever. We're all trying to produce a graduate who is competent to do the job within the setting in which they are employed in a safe manner, you know. So I mean, we shared resources with UL, for example. UL shared resources with us in UCD around the dietetics. I'm sure the same happened in other programs, and it will be useful to capture all of those and to really try and use that to reduce everybody's stress and really, I suppose, take this opportunity and take some good out of this pandemic to sort of move forward in a very united way.
Because I think it supported people to actually think a little bit differently about what was normally the process, and where there were components within a placement or aspects of a competency that could be done remotely. Then it was thinking about how you could actually deliver that. And I think that came across from the comments that we got from other programs was, you know, they hadn't really thought about the ability of, say, telehealth or doing remote data gathering as an exercise. And then we also had the innovations around using COVID health situations as actual placements. And I think that was another one of the novel findings that we had. So out of America, they had COVID hospitals. So the students actually went on those kind of outreach COVID situations. And they also did things like contact tracing as part of understanding how health works. And I think they were really nice ways of taking learning from a difficult situation and adapting learning outcomes so that the competencies could still be met.
Mm-hmm. So, for example, in UCD, we did some contact tracing with our dietetics and Masters of Physiotherapy students. And also, you know, the UCD volunteers overseas, like the placement that the students would normally go to Uganda or India or different parts of Africa, not just Uganda, Tanzania as well. You know, they managed that remotely, and there wasn't enough time to give all the detail here, but the students actually benefited hugely from that. And they actually have really good telehealth skills now that students in previous years would not have had. Some of the online delivery, I suppose, of placement, like while the majority was done within, say, the community areas still on site, there was quite a bit of telehealth being done, and then also even there was opportunities perhaps to work with, say, the health service or Department of Health. We had those opportunities that would never have been previously available, but the staff within the Department of Health, so very core high-level staff, took students and gave them wonderful insights that they would never have had previously. So there was good as well as difficulty. And I think the students overall really appreciated the work that staff put into adapting and trying to, I suppose, make the best of the placements.
Great.
And placements are the key issue. I think everything else, the teaching online is difficult, both for students and staff, but is more manageable. But that on-site learning or where you have a lot of practical aspects in a program. So for example, physiotherapy would have enormous amounts of practical classes. Those are difficult, without the face-to-face. But certain aspects can be done and certain competences can be achieved. And certainly the contact tracing, we map those against professionalism, and we could actually have mapped them against communication skills as well in retrospect. And they were very useful for students. So,
Yeah. And sorry, just time for one more quick question. You mentioned kind of previously sustainability over the long term, both in terms of for the program directors as well as obviously students on the placements. So I was just wondering what you're thinking where in terms of how this experience could be sustained over the long term, given that we are now in the third wave of COVID and you undertook the study during the first wave. And I suppose if you're planning to do any follow-up studies looking at the longer term impacts of these challenges over a longer period of time.
It certainly would be nice to do some follow-up, and it would be lovely to capture the good. Like, you don't want to get always caught up with the negative. I think all of us are exhausted, both within the clinical sites and within the academic institutions. I think all of us are exhausted, but at the same time, there was good and you want to capture that. So it would be nice to make sure that the good pieces are captured and then don't get lost, that are actually then integrated. So for example, when we come to the next program approvals with our own regulator, that those pieces that really benefited students are actually captured, and that we do try and get maybe some evaluation from the students and from our placement providers as to how beneficial they were, and how much they benefited patients. Because again, I suppose we don't have those data yet, but anecdotally, I've spoken to lots of dietitians and students who found that actually calling patients was really useful, rather than dragging them up to, say, a hospital setting or a primary care setting. Actually making that phone call, they knew they were going to have a consultation with their healthcare professional, and that they had the time put aside, they had everything prepared, they didn't arrive in hassled because they'd had to park or couldn't find parking, were worrying about delays, that they were going to get a parking ticket when they went out. So there were aspects in telehealth that I suppose other countries have used perhaps more widely than Ireland. So countries like Australia, that are so large geographically, have used, that we should try and retain and make sure that we try and integrate some aspects over the long term into our programs.
Just one quick question that's come in from an audience member I just want to try and get to before we finish up. So just a quick question, quick response. Were there any particular mental health difficulties experienced by students that you found? I know you were doing a survey of the program directors, but did anything come through?
We didn't get anything explicit, but there were mention of anxiety issues being exacerbated within students. And then there was one explicit quote where a student was considering dropping out of the course because of their mental health issues that were being exacerbated by COVID.
The other aspect from a student perspective that came through from the program directors was the financial aspect. And that was, the details of why that we didn't capture, just that was. We can only presume, that perhaps students who are on fee-paying programs have part-time jobs, or whether they're undergrads or postgrads, or whether fee-paying or not, that maybe parents lost jobs, or those who are providing support for them lost jobs or had reduction in hours, with subsequent reduction in salary. But that came across quite strongly as well from the program directors. So they had picked up on that through their students.
Well, unfortunately, it's just after 2:30, so I have to wrap up. I'd just like to start by thanking Sharleen and Clare again for their time in speaking with us today on their study, which was fascinating. And thank you very much for sharing your findings with us. And also thank you very much to all of our attendees for joining us. Just to let you know that our next UCD COVID-19 Research Seminar Series talk is on Wednesday, the 3rd of February at 2 p.m. And Professor Wim Meyer, who is the head of the School of Biomolecular and Biomedical Science, will be presenting his findings on his study, The Surveillance of SARS-CoV-2 in Sewage to Gauge Prevalence in the Community, which has proven really fascinating findings and has actually evidenced, seen a huge spike in our recent wave 3. So very interesting, I'm sure. Hope you can join us. So thank you very much again for everyone for joining us, and have a nice afternoon. And thank you again, Sharleen and Clare.
All right,
Thank you.
Thank you.